بسم الله والصلاة والسلام على رسول الله صلى الله عليه وسلم. This is the eighth lecture in the series of lectures about the balloon mitral valvuloplasty, and we'll speak today about what's new. The use of the lithotrepsy to facilitate balloon mitral valvuloplasty in heavy calcified mitral valves. The story started with surgery. They used the lithotrepsy during the open mitral commissurotomy in heavy calcified mitral valve. Then the technique started then the technique started in intervention to use the lithotripsy to facilitate either the balloon mitral valvuloplasty or percutaneous mitral valve replacement. In 2019, the first case reported an 81 years old man with heavy calcified mitral valve, and they used a three balloons, peripheral lithotripsy balloons, to crack the calcium before doing the balloon mitral valvuloplasty. The operator passed the mitral valve using the ordinary sheath, then a wire introduced inside the left ventricle, and over this wire, a multi-purpose 7 French catheter guiding catheter introduced to the LV, and through this 7 French multi-purpose catheter, three Grand Slam wires .014 passed to the LV. They used the Grand Slam wire to ensure the good support of the balloons. And sure, the idea to use three balloons is the larger circumference of the mitral valve compared with the peripheral arteries. And the balloons must be in touch with the surface they crack. So they used three balloons simultaneously, and they fired the balloons simultaneously. Also, the rapid basing at a rate of 120 beat per minute used during firing the balloons. After this, they used ordinary single balloon dilatation by true dilatation with 28 balloon and the 13 Zimmed balloon with good result. Since that time, many papers published about using this technique either before the balloon mitral valvuloplasty or before mitral valve replacement. This picture shows the case of the three lithotripsy balloons and single dilatation thereafter. In 17 patients out of the 24 cases reported since that time, they used cerebral protective device. One of those patients with no cerebral protective device developed cerebral embolization and stroke. And since that time, they must use a cerebral protective device during this technique. Also, complications reported in the form of the increase of the degree of the mitral regurg and with RV perforation necessitate extracorporeal support and extracorporeal membrane oxygenation and surgical repair. Also, the regular complications may present the form of pericardial effusion that required pericardicentesis, also complete heart block. And interestingly enough, they show the improvement of the pliability of the valve during the surgery or during the procedure using the transesophageal echo. These live pictures shows the case of the 81 years old man, usage of the three balloons simultaneously, the heavy calcification of the mitral valve, and the dilatation of the mitral valve thereafter by the Zimmed balloon, and the good result with no mitral regurg. Since that time, they tried to do a modification of the technique to make it more simpler. They used two balloons instead of the three balloons, and the result was also good. This table shows the procedural steps, step by step, and the equipment used during this maneuver. In some cases, they not only use the cerebral protective device, but also a subclavian occlusion balloon to make sure that there is no debris will go to the brain or to the upper arm or to the vertebral arteries. Pictures of the facilitated lithotrepsy before doing percutaneous mitral valve replacement. At the end, this technique is starting, and sure, we need a larger prospective studies, not a retrospective series, and also a dedicated IVL balloon for balloon mitral valvuloplasty to do both the dilatation and the lithotrepsy with a caliber of the catheter, with a size of the catheter corresponds to the mitral valve, to not use the peripheral balloon instead. So we came to the end of the series of the single balloon mitral valvuloplasty. We went through the history, the echo data, and the echo scores, the guidelines and patient selection, then the interatrial septostomy technique, then the balloon mitral valvuloplasty technique itself step by step, including the tips and tricks related to the technique and to the balloon itself, and then the complication, how to diagnose, how to suspect, how to manage. Then lastly, what's new in the field of single balloon mitral valvuloplasty, the use of lithotripsy either before the balloon mitral valvuloplasty or percutaneous mitral valve replacement. Thank you.